$20 million to make sure that we had all of these safety precautions in place for students and staff.
So you've got some people, doctor, some kids who have been in school throughout this pandemic, one way or another. They've been in person, and you've got other schools now still not quite there. What do you tell parents or teachers who may be uneasy about a return to the classroom now?
Well, of course, we're all worried about our children. I'm the father of two myself. I have two kids in school. And one of the things that I'm encouraging, especially now that the Pfizer shot is available to children 12 and over, is encouraging all of our parents to go and get their teens and preteens vaccinated, because that's one of the best ways of protecting their children, as well as reducing the amount of transmission in the schools.
All right, well, let's talk more about vaccines then, Doctor. Moderna today seeking full approval now for its COVID-19 shots for those over 18. What does that process entail, and what's the difference between emergency approval and full approval?
Sure. So initially, both, not just both, all three vaccines, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine, when they have preliminary data, what they do is they bring this to the FDA to see if they can get emergency use authorization in an emergency. We're in the middle of a pandemic, and so they were looking with the preliminary data that they had to get preliminary approval from the FDA to allow that to be available. That is just preliminary, and the FDA grants that with the intention that when more data becomes available, that you present that more formally to get formal approval for the vaccine. This allows certain things to happen. One thing is the pharmaceutical companies can then have direct marketing to the population for their product, just like you see on television commercials for other medications that are out there. In addition, the other thing that it affords an option is more people would be accepting of getting mandatory vaccinations. So when you go to the schools and you have mandatory vaccination for flu shots every season, let's say, or at the hospital where I work, well, we mandate that all of our employees get a mandatory flu vaccine to protect not just ourselves, but more importantly, the patients that we serve. By getting a full authorization, that paves the way so you can then mandate hospitals, let's say, to mandate their employees to get vaccinated. So this way we're protecting our patients.
All right, doctor, stay right there. We're going to come back to you in just a bit. Very interesting information about how this will all play out. We're going to continue to watch it. Okay, we've got more news on the new normal still ahead. A new case of bird flu confirmed in China, what that could mean for us here in the U.S., plus a surge in travel and a major U.S. city now fully reopened. That and more here on the new normal. Now let's take this conversation online. Our Macey is moderating a panel of guests on Facebook Live.
Yeah, Rich, we've got a great panel from across the region of experts who are here and ready to take your questions, anything COVID related. We'll be talking about getting back to normal. What does that look like? Kids going back to school after the summer, vaccine hesitancy that we're still dealing with, and of course the emotional toll of this pandemic that it's had on all of us as we get through this and head to our new normal. So please join us on Facebook, join our panel, and let us know your questions, your comments, your concerns, and we will talk about all of that. Join us on Facebook Live. We'll be right back. Hi, everybody. Thanks for joining us here on our Facebook Live version of the new normal for the News 12 regions, where we are taking your questions, your comments, your concerns, and getting them straight to the experts from across our region so you can get the answers you need and are looking for. Today, we've got three great guests taking time out of their night to join us. Thank you guys so much. I want to introduce all of you separately so we know who we're talking to today. First up, we've got Dr. Martine Hackett. She is an associate professor with the School of Health Sciences and Human Services at Hofstra University. Dr. Hackett, thanks so much for being with us tonight. We really appreciate it.
Thank you.
We also have Dr. Rossi Hassad. He's been with us several times here on the Facebook Live version of the new normal. He is an epidemiologist and professor at the School of Social and Behavioral Sciences at Mercy College. Dr. Hassad, good to see you again. Thanks for your time.
Thank you, Lacey.
We also have Dr. Liz Matheis. Dr. Matheis is a psychologist for us in New Jersey, so she'll be able to speak about the emotional toll this pandemic has had on all of us. So Dr. Matheis, thank you so much for your time tonight.
Thank you for having me.
All right, so let's dig in here. We've got some viewer questions coming in, and we'll get to all of those. But I want to start by talking about things we've learned today. What's new today in this new normal that we're all dealing with? Moderna seeking full FDA approval for its vaccine. We all know it's had some issues in the past, some reports of blood clots linked to that vaccine. Dr. Hassad, I want to start and get your thoughts on that first today, since that's the newest topic we're learning today. Do you think Moderna will have trouble getting that full FDA approval?
Not at all. And in fact, there were no major concerns of blood clots associated with Moderna. It was largely the AstraZeneca and the Johnson & Johnson vaccine. And Moderna is using the same technology as Pfizer, the mRNA platform. And I have no doubt that they will both receive full approval and licensure. And it's coming at the right time because emergency use authorization is given earlier. It's a preliminary authorization based on a small amount of data. But in order to get full approval, one needs at least 6 months of data showing safety and the efficacy of the vaccine. And I think that this is the right time. It comes just after Pfizer because they were approved in that order. I'm fully confident that they will both be granted full licensure.
Gotcha. Excellent news there. So let's talk also about people 12 and over being able to get the Pfizer vaccine. Dr. Matheis, you work with children and parents, obviously. What's the feedback you've been getting on that? Are parents open to getting their kids vaccinated?
They are, and they are getting their children vaccinated because they do want their children to be able to go back out into the world and safely without worrying about how many people, masks or no masks, and being able to eat with each other, which is a huge part of our children's social interaction, which they've been really missing for a long time.
Absolutely. All right, we got to get back to the New Normal TV program here, but we're going to be back in the next commercial break answering more of your questions. So please keep sending them and we'll get them to the experts. Thanks, guys.
U.S. air travel is booming. Were you among those catching a flight this past holiday weekend? If you were, you certainly were not alone. U.S. airports logged their busiest weekend of the pandemic to date. The Transportation Security Administration screened nearly 9 million people between Thursday and Monday. That includes nearly 2 million alone on Friday, a single-day record during this pandemic. And right now, Las Vegas is fully open once again. Sin City today returning to pre-pandemic guidelines, and there were celebrations and parties across the Vegas Strip. Capacity once again at 100%. And for a city that runs on tourism, that means more revenue for business owners who have seen a major drop in their bottom line.
It was quite heartbreaking to shut operations down for 15 months.
Well, the changes also mean that Vegas venues can operate at 100%. However, businesses can still implement social distancing and mask requirements if they so choose. And Vegas authorities have warned that if hospital capacity does rise, COVID-19 protocols could return. Let's bring back in Dr. Frank Illuzzi. He's the medical director of specialty services at Hartford Healthcare. Doctor, thank you for being with us here. Let's talk about Vegas and travel in general. That means social distancing is going to be waning in many areas. What should we be doing when traveling within the U.S. right now? Obviously, there's a whole big pent-up demand to, get out there again.
Absolutely. So believe me, I understand, where everybody feels. This has been a very, very long year. And as we see the numbers come down, people want to get out and they want to enjoy themselves again. I don't mean to be redundant, but I think that, the best way of protecting yourself is to get that vaccine. The vaccines have proven to be very effective at preventing you from getting the illness. If you are traveling, I know the airlines still have regulations in place. You have to wear your mask while you're on the flights. I know there's been news reports of people being very upset about this and taking it out on the flight attendants. First of all, it's not the flight attendant's call, but everybody needs to wear their mask on the plane. In addition, when you get to where you're going, you have to understand that the other people, if you're vaccinated, the other people there might not be vaccinated. So, you might want to try and do, open air, eating outside, and try and limit the amount of times that you're in an enclosed environment with a lot of other people.
There's still a bit of a risk-reward calculation for everybody, despite the low numbers. Now, Doctor, as more places reopen, restrictions are being lifted, people are getting outside. But tonight there's a warning from the U.S. Surgeon General, Vivek Murthy, who says the time many people spend in isolation could lead to another epidemic, loneliness. Take a listen.
That loneliness is that it's linked to not only increases in depression and anxiety, but to shorter lifespans, to an increase in premature death, to increased incidence of dementia, to sleep disturbances, and so many other conditions.
Doctor, I think we've all felt that to a certain extent, but obviously for some people, it is really at a heightened level right now. What are some of the warning signs we should look out for our loved ones and also for ourselves? Sometimes people don't realize it.
No, absolutely. I completely agree with Dr. Murthy. I'm an emergency physician, so even in my practice, I'm seeing patients coming in with increased anxiety, increased depressive symptoms. Things that you want to look for are changes in behavior, changes in sleep pattern, changes in eating habits, loss of interest in things that people like to do, not calling back or reaching out to other people, being withdrawn. Having what we call as a poor psychomotor type response, where people just look down and they don't maintain eye contact. Anything that's changing in, your loved ones that you're concerned of, please reach out to your primary care provider. Please reach out, to your emergency department or somebody who you trust, and please reach out for help, because the help is out there. We do want to help people, but obviously with the year that we've had so far, this is a problem that is now coming to a head, and we have to deal with it in an appropriate fashion.
Doctor, are you concerned that some people may get lost in the shuffle, so to speak, especially as we have so many now being able to take masks off and go out again? People may feel badly if they're not quite ready to do that. There's a certain anxiety there for some to remove the mask, even if they are fully vaccinated, etc.
I think that's a very good point, and one well taken. I think we have to be appreciative of where other people are. Some people are not ready to take off the mask, and I think it's important for us as a society to allow people their comfort zone. If they're not ready to take off the mask, then I think that's completely appropriate that they continue to wear the mask. If you've been vaccinated and the CDC recommends that you can take off your mask when you're doing daily activities, then you can go ahead and do that. I think it's very important that as we transition back to normal, that we give each other a lot of leeway and we try and be, nicer to each other than we've been in the last couple of years.
That's very true. Doctor, I want to ask you real quickly about what's happening in China right now. A confirmed case of the bird flu H10N3. A 41-year-old man lives north of Shanghai, hospitalized back in April. He's in stable condition, doctor. The Chinese government says the risk of large-scale spread is low. But when you hear about this kind of thing, obviously nerves get rattled very easily these days. What can you tell us?
Well, I think this highlights that we're in a global community, and we have to keep our vigilance up. This is how animal zoonotic diseases jump and come into human beings, and we have to have adequate surveillance. We have to do the appropriate science, and then we have to be transparent with information and give it across borders, so this way we're ready for it. I mean, I remember back in, when I was starting out my career, when we had the H1N1, the 2003 virus, and how that nearly caused a global pandemic.
Right.
I've lived through H1N1, and now we've had the coronavirus pandemic. These are going to happen from time to time. So it's just a matter of maintaining our vigilance and being very transparent with the communication of what this disease entails.
All right, Dr. Aluzzi, thank you so much for your time. We appreciate it. And there's more to come here on The New Normal on News 12. We'll be right back.
All right, we are back with our panel here on Facebook Live. Thanks for joining us here on The New Normal. We're taking your questions, and we've gotten a lot of great questions so far. I want to start with Cynthia Wilson's. She is asking, can you assure me if I take the vaccine, I'm not going to catch COVID? We do know there have been some breakthrough cases, So, Dr. Hackett, I want to give this one to you. How would you respond to Cynthia on this question?
There is no thing as zero risk, but it's as close as you can get, basically, especially if you've had both doses of the vaccine or the one dose of the Johnson & Johnson. You are in really just about as sure as you can be of anything else that if you that you will not get COVID. And if you did, that the symptoms would certainly not be severe and the risk of hospitalization is almost zero.
Mm-hmm. So some protection is better than no protection, of course. But Dr. Hassad, these breakthrough cases, have been a little alarming for people, especially when you think about the Yankees team. You know, we were reporting on that a few weeks ago when several team members had COVID and were vaccinated. What are your thoughts on these breakthrough cases, Dr. Hassad, and especially with that team who was all fully vaccinated?
On the statistics we have, the percentages we are seeing, they're within the margin that we would expect, given the level of effectiveness of the vaccines. So nothing about the number and distribution of breakthrough cases we have seen takes away from the effectiveness of the vaccine. And this is true. There is no vaccine that is 100% effective. In the case of the Yankees and the 8 folks who became infected, that it's an anomaly. I wouldn't say that is so much breakthrough. I would offer another hypothesis that could have been a bad batch of vaccine, poorly administered, or it could have been a particular variant of the virus that they were all exposed to, that the vaccine did not protect them fully against. Now, it's good to note that in all instances, no one became ill. Mm-hmm. There were extremely mild symptoms, if any symptoms at all.
Yeah, that is the good news. Absolutely. We are going to continue this conversation until about 7:45. So continue to bring in your questions. We'd love to hear them. I'm going to take a few more right now. So this one is interesting. Carrie Stable says, our friend doesn't want to get vaccinated and also doesn't wear a mask when she visits. We are all vaccinated. How strict about this should we be? First, Dr. Hackett, I want to get your thoughts on this, but then Dr. Matheis, I want you to follow up. So just really quickly, Dr. Hackett, how strict should people be when they're vaccinated and they want to hang out with their friends who refuse to do so?
I think it really comes down to just that level of risk. And if you're in a household where everybody has been fully vaccinated and there's one person who isn't, the chances of you getting sick are very, very low. And, in fact, the person who's not vaccinated should be the one that's a bit more concerned. And so I think, you also have to balance that out in terms of your friendship, right? And how strict you want to be in terms of, preventing them from getting together.
Right. Well, that's what I want to talk to Dr. Matheis about. If you're just joining us, Dr. Matheis is a psychologist in New Jersey. How do we set that boundary, with our friends and our family? That's a tough spot to be in. You don't feel too comfortable being around someone that's not vaccinated. How do we do that?
I think we just have to have those awkward conversations and those very candid conversations. If you're truly uncomfortable and you don't want to be around that person, I think you're going to have to make it clear that I'm just not comfortable. And, sadly, I think we're all going to need to set our boundaries in terms of what we are comfortable and what level of risk we're willing to expose ourselves to. And really, it's the person who hasn't been vaccinated who's gaining the most exposure than the people who are vaccinated. But this is a time where people have to really figure out, how do I want to re-enter? And some people are ready to jump in with 2 feet, and some people are not, and they're going to take it very slowly and just slowly graduate their level of getting together with people, and with or without masks, and eating or not eating, and how many people, indoors, outdoors. Fortunately, because it is approaching summer, we do have the benefit of being able to be outdoors. So that works for us. But I think we're just going to have those awkward conversations that we don't want to have.
Right. I mean, this is such a process getting into this new normal and feeling comfortable. You know, the CDC lifting the mask mandates, and now more of us are walking around in certain stores without our masks. Some people are still wearing our masks, and you feel like, oh, who's going to be the first to take off their mask? You know, it's awkward. It's uncomfortable because we've all gotten so used to these masks. So I want to talk about the CDC guidance on that. Do you guys, and I'll start with you, Dr. Hackett, do you think it was too early for them to lift the mask mandate at this point?
I think one thing we know is that the vaccination rates are different across the different states. Yeah. And so since the CDC is responsible for the entire country, I do think that, you know, it's not the same everywhere. And so there probably should have been a little bit more of a restriction in terms of the percentage of the population that was vaccinated that could then go mask free. I think that might have made a little bit more sense to people. You know, otherwise, why were we so restrictive? You know, they were asking us to double mask just, you know, a few weeks before this. Yeah. And so I think that to give people some of that, you know, stepwise way of being able to ease back into this probably would have been better advised. But I think that, you know, we're sort of past that at this point, and it really is now up to the different states as well to be able to implement based on their infection rates and vaccination rates.
Dr. Hassad, when you heard about the CDC lifting the mask mandate, what were your thoughts? A lot of people were surprised by that. What about you?
I fully endorse what Dr. Hackett said. I felt that there should not have been a universal recommendation, but recommendations that people should pay attention to community spread where they live at the local levels. And so, yes, I understand the analysis, but I do not feel that a universal recommendation for an entire country where there's so much variability in the level of spread was the most effective recommendation.
So we're going to talk about, it's great to see, you know, the infection rates down as low as they are here in New York, in New Jersey, Connecticut. So I want to get back to vaccine hesitancy, but first I want to talk about something that is on a lot of people's minds, parents especially, obviously. Kids just had a really tough year, in school, kids of all ages. And we've got Dr. Matheis tonight who can give us some great insight on that. You work with children, right, Dr. Matheis? So what's it been like the past year? And are you seeing anything different in these kids as we talk about going back to school in the fall?
Our children have really been suffering. Children, adolescents, young adults, children of all ages have really been suffering. The number of calls that I get per day with anxiety and depression, school refusal, school burnout is immense. It's sad. It's very discouraging. And our children have really, really been struggling. School has been very different. There's been a lot of loss in terms of milestones throughout the school year, extracurricular activities, social isolation, having to really self-direct in their academics. So my advice for the summer for every parent right now is let your children have as carefree of a summer as possible, and let them really regain their mental health and be outside as much as possible. And as with parents comfortability levels, allowing our kids to socialize and be out and about, because they're hurting, they're suffering. And they miss that. I work with a lot of teens who are in their basements doing school all day via computer, and it's just not the same.
Yeah, I can't even imagine. I mean, it's got to be so tough, constantly staring at that screen for your education and your entertainment, your time off. It's just so different. It's so different. So we kind of got cut off before because we were as part of the TV program when we were talking about children getting vaccinated. So I just want to bring that back up really quick now that kids 12 and older can get it. And you said you are seeing that a lot of kids are getting it. Have you heard of any hesitancy from parents in your practice?
There are some parents who are hesitating because they're not sure of the long-term effects. I know for myself, I consulted with my child's pediatrician, And I have 3 children, so and 2 of them are over 12. And my thought was, let me go right to the source of accurate information and find out, is this good for my children? And when she gave me the thumbs up, I moved forward with that.
Mm-hmm. That's great. So Dr. Go ahead. What are you going to say, Dr. Matheis?
But there is, I think, true with everything. You're going to have parents who are going to hesitate just because I feel like they're not entirely confident about there being enough data. But then there's other people who feel there's enough data.
Right. Dr. Hackett, I want to bring that to your attention as well, that children getting vaccinated. You hear a lot about parents, they were gung-ho about getting themselves vaccinated, but now that their kids are eligible to get vaccinated as well, they're kind of like, well, wait a second. What do you think is causing the hesitancy when it comes to the kids getting it?
Well, I think hesitancy, we also have to remember, right, is has a spectrum in terms of the reasons why. From one end, people who are adamant about not getting vaccines for themselves or for their kids, that existed before COVID. To an area that Dr. Matheis mentioned in terms of people just not having enough information and not feeling comfortable with that level of information, and people just knowing more people who get them. Remember, kids have only been offered this option for just a few weeks. And so I would argue that, just like anything else, that once, your kids' friends start having it and your relatives, and you start seeing that people that you know and you trust have it, and you see that it's safe, and it also is the key to opening up a whole world for kids that they didn't have access to last summer. I think all of those things are going to help over time for us to see parents becoming more supportive of getting their kids vaccinated.
Mm-hmm. Well, Dr. Hackett, Joe Biden has a goal by July 4th of having 70% of eligible Americans vaccinated with at least 1 dose. First of all, I'll start with this. Do you think it's possible, 70% of Americans by July 4th?
Well, we are currently now about 51%, I think with 1 dose in the United States. And so that's pretty good over these last few months. I think that what we have seen also too across the country, different states offering incentives for people to get vaccinated, whether it's free tuition, MetroCard, lottery, chance to win, $1 million. It turns out that those are effective. Those are carrots, ways to be able to sort of entice people who might be sort of on the fence. And in some states where they have offered these incentives, vaccine numbers have increased very dramatically. So I think that is something that will help, and the federal government supports this as well. So I think to be able to have more opportunities to give people incentives, in addition to work requirements, I think, which is sort of your stick, I think that those are going to be ways that more people are going to get vaccinated. And it seems to me that 70% is certainly with a possible goal.
Mm-hmm. It's great to hear those incentives are working. Anything to get more shots in arms. That's fantastic news. But Dr. Hassad, for the people who still are very against this, in your opinion, what's keeping them from getting this vaccine, even with all the extra incentives that are now being offered?
Well, I concur that there's a spectrum of hesitancy, from people who are firmly opposed to those who are waiting and seeing, to others who may feel, I need more information to move in that direction. You will always have a small proportion of people who are opposed to vaccines, and you will not get them to go in that direction. I do believe that now there's a phenomenon that might be operating right now that can add to hesitancy, and that is with so many people having become having received vaccination, and we are opening up back to society, there's a feeling that all is well, it's okay. And so you may find people who are saying, well, maybe I do not need it after all. You cannot rule out that thinking. I have experienced it with people around me.
Mm-hmm. Yeah, that makes sense. Yeah, and that's what I was, thinking with the CDC mask mandate too. People who aren't vaccinated, who are still supposed to be wearing it, are thinking, oh, it's no big deal, it's fine, I'll leave it off. So a lot of people, both vaccinated and unvaccinated, now walking around without their masks on. So hoping to keep those infection rates down. We've got a comment here from Cheryl Shimko. And Dr. Hassad, I'll direct this one toward you. She says, my mother had a blood clot from Moderna and almost died, needed 3 brain surgeries. How can anyone claim any data that hasn't been fully collected? So this is going back to the question about Moderna getting full FDA approval. Let's talk about this, the blood clots and their connection to these vaccines, but also, they're very common and can be caused by a lot of other things. So I guess what would you say to Cheryl, whose mother was almost died?
First of all, I'm sorry to hear about her mother's experience, and any illness is a major concern as a Cheryl's mom. Now, if you look at this from a population basis, we think in terms of the risk, the overall risk. And while we know of Cheryl now and her mom's situation, the risk of clots remains very low. And so it's unfortunate when someone develops it and becomes ill, but it's not something that you will see in a widespread manner or occurrence. So it's not comforting to the person who became ill, but on a population level, it will remain very rare based on historical data and what we're seeing now.
All right, let's switch gears here and talk to Dr. Matheis again, kind of about the emotional toll this pandemic has taken on all of us. We had the study in the TV version of The New Normal just earlier about loneliness and the health effects that can come from, the negative health effects that can come from just being lonely, from all of us being isolated. A lot of people, when they're lonely, some do seek out friends, family, ask for that help, but others retract even more. So what advice do you have for us, Dr. Matheis, as we all kind of start to get back out into the community and gather with our friends and family once again after being alone for so long?
Yeah, that social isolation really led to a lot of feelings of sadness and anxiety and lethargy, weight gain, oversleeping or undersleeping, really changes in body image, changes in academic performance. I have several students who are very high achievers, and now they can't motivate themselves to hand in a homework assignment. And it's really hard. My advice is for parents to normalize going back out into the world. If you need to put some parameters around it, please do, but really encourage getting together, going out. Once you're vaccinated and 2 weeks after your second vaccine, I think the numbers stand very strong in terms of being able to go out and socialize and having low risk, and really encouraging our kids to make plans and to go out of the house because they've been inside for so long, and to really find things that they enjoy doing again. If they're really struggling and you're seeing that despite being out, opening your windows and doors and saying go, they're not going, is then to really get an understanding of what's happening, what's standing in the way, and seeking professional help if that's there's more to what's going on.
Mm-hmm. Great advice. I want to wrap this up with a question that we get every time we do this show, and something a lot of us have been wondering personally. But Kim Hugh-Schneider-Nunziata says, how often will you have to get the vaccine? Something a lot of us are wondering, right? So Dr. Hackett, I'll address that one to you. Any new insight on how often we'll have to get these booster shots?
One thing I saw recently is that even people who have COVID, who had COVID, they're even 10 months afterwards, they still have antibodies. So I think that's kind of promising in terms of sort of thinking about how long we can wait before we have to get a booster shot. It seems that with the effectiveness of these vaccines and with these, even though there are the presence of these different variants, that they're really not penetrating and increasing the infection rate and the hospitalization rates. That, I can't have a crystal ball in terms of exactly when, but it seems to me that it's probably going to be a little bit later than were originally anticipated.
Mm-hmm. We also reported not too long ago that there's talk of possibly combining the flu shot with the COVID booster. I don't know if you guys read that, but boy, wouldn't that be convenient every year to just get the one shot. And if you've gotten the shot, you very well know it's pretty easy peasy and not too big of a deal. So if we do have to get a booster shot, hey, anything that will work to protect us, right? We'll take it. So thank you, all three of you, so much for your time tonight, for answering our viewers' questions and taking their comments. We appreciate your time. And to the viewers, we appreciate you sending in your questions. So thank you very much. Stay safe as we all work towards this new normal together. I appreciate you guys being here with us. Thank you.
Thank you all. Thank you.
Thank you.
Thank you.
Take care.